This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've come up with the same old. Not anything that really works very well. Well, here's an opportunity. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you. We have a couple things that we're going to discuss with you on this absolutely gorgeous, spectacular, beautiful fall day in Washington. I mean, you can't be blessed. Put this day away for like January, when things get a little iffy out there, and then pop it open and you can really enjoy it again. So I have a question for you. Here's the question. What does neck pain, neck stiffness, shoulder pain, dizziness, low back pain, arm numbness, hand numbness, blurred vision, ringing in the ears, not being able to concentrate, your face hurts, your jaw hurts, you got vertigo, you're nauseous, memory problems, sleeplessness, and tiredness. What do all those things have in common, Dr. Browning?
Well, very often it has to be head trauma, and this week we're going to talk a lot about head trauma, specifically as it relates to whiplash injuries and motor vehicle accidents, slip and falls, and all those types of things. In studio, Dr. Harlan Browning, your host, your presenter this Wednesday evening on the subject of trauma and head problems. But, those things that happen because you're getting your head beat up in a car accident, not a good thing, or not necessarily a car accident. That's one of the things that we're going to bring out to you. So guess what? It's October the 1st this Wednesday, and at 7:30 p.m. at the Roselle Center for Healing. Please be our guest if you'd like to join Dr. Browning and talk about these issues. If you've had any of those symptoms or others that we're going to get into today, give us a call at 703-698-7117. That's 703-698-7117, and tell my staff that you'd like to be there. Dr. Harlan, so my question is, to begin with, when we think about whiplash, we think about being rear-ended, and I've been the target of that. But there's other types of trauma that can be designated and classified as whiplash. Why do we have that kind of big blanket and only look at it as a car? But talk to us about some of the other things as well. Well, in reality, whiplash just means that the head goes in multiple directions. Typically, in a motor vehicle accident, it goes into extension, the head goes back, and then it violently moves forward into deflection. But that certainly can happen in many instances. We see it in athletics all the time. A football player gets hit and his head snaps back, or we're walking down the sidewalk and we don't pay attention to what we're doing and we trip and we fall. So it falls in multiple categories, but the end product is your head's going to move in directions that it's not necessarily designed to do.
How about those guys who sit in front of the tube and watching the football game, and they kind of use it as background fodder noise, and all of a sudden their head drops down to their chest because they fell asleep?
Well, you could definitely look at it that way. If you put your head in a position that for too long of a period, then you're going to strain the structures there. You're going to strain the ligaments, the tendons, the musculature. The end product's going to be pain, and if you do that over and over again, you're going to develop chronic type pain. So it's a very real thing.
I sit there and I watch the tube at nighttime, try to, not for any reason whatsoever, just kind of go brain dead and give Sue some company because I haven't seen her all day long. But invariably, within about 10 minutes of putting my carcass on the sofa, my head starts bobbing and weaving, and all of a sudden Sue will come over and put a pillow underneath my neck so I don't hurt myself. But the truth of it is that those things we don't think about. You talked about slipping on sidewalk. Just grabbing your toe against the elevation and pushing you forward, your head will go down. There's so many different ways of causing that to happen. But trauma, you talked about football and impact injuries. The number one cause of head injury and whiplash is not even football, it's soccer.
Yeah, well, because they had the ball. And there's a huge movement away from kids playing football because I think it's overly perceived as being too dangerous when the research bears out that there's more concussions in soccer. So there's a lot of opportunities in athletics to injure yourself. So we always look at football as the number one, and it's not necessarily the big dog anymore.
Okay, so we started out the program talking about all these symptoms. I kind of led into it talking about pain and neck and shoulder and hand numbness and the like, ringing in the ears. People say, well, what does that have to do with the whiplash? Vertigo, dizziness, being almost passing out, stomach upset, nausea. How do these things happen? Why do these symptoms occur when in some cases they don't seem to be related at all?
Well, when we injure ourselves, we have fibers, neurological fibers that go to the brain to tell us that something's been injured. And these fibers branch out and they talk to what's called our autonomic and sympathetic system. So we get this entanglement of these other symptoms like the nausea, the dizziness, the ringing in the ears, because the pain fibers talk across multiple platforms. So for a lot of folks, the pain issue is momentary, but the lasting effect may be that they have unsteadiness, or they have this feeling that they're just not stable, or they're spinning. So in reality, that autonomic response can be much more dramatic than the pain.
888-630-9625. That's 888-630-9625. That's how you find us here. And if you'd like to attend this Wednesday evening's presentation at the Roselle Center for Healing in Fairfax, we're right on Route 50 near the National Capital Beltway. All you got to do is call us, 703-698-7117. That's 703-698-7117. Want to remind you that all of our in-house presentations, what we call our continuing education programs, are for you at absolutely no charge whatsoever. It's our gift to the community. All we require is a reservation. Just let us know you're going to be there so we can schedule properly and we can prepare the information that we want to give you to go away with. So give us a call, 703-698-7117. Dr. Harlan, listen, a lot of people come in and, years after the fact. And, you go through and my neck hurts, I got a headache. When did it first start? Well, last week. No, when did it really first start? And they said, well, I've had headaches for years. What happened at that period of time? How many years ago did this thing show up? And then pretty soon you dig out that there was an injury, there was a trauma, and I said, well, were you in a car accident? They said, not anything significant. Well, what was significant? So here's the question. People think that you can only be injured if you're in a crash that, ruins the car. And unfortunately, the insurance companies, because of money reasons, will look at it and say, well, you really didn't get hurt because the car didn't get hurt. So what do people have to know about when it comes to any kind of impact, whether it's trauma, somebody comes up behind them, hits them in the middle of their back and pushes them, they fall, they trip. What's the impact? Is there a level of acceleration, deceleration that's critical, and it has to be above that, or I'll let you fill in the blanks.
Well, it doesn't. When you get into a motor vehicle accident, it doesn't have to necessarily involve a high speed for the person to be injured. As a matter of fact, there's a researcher out there called Arthur Croft. He's a chiropractor. He's in the same field as we are, and he's done studies over the years that looked at low impact collisions and the amount of damage that's done to people. And you hit it right on the head when you said that the insurance companies will look at the speed of the accident to determine if the person really has injuries, and in many cases that's not a valid way to interpret it, because we can get into a fender bender only going 15 miles an hour, and the person can have substantial injury to their neck or their back or different parts of their bodies, especially when you consider the airbag that deploys.
Well, the interesting thing, and it goes back to his work as well. Someone who's hit from behind at 15 miles an hour, 12 to 15 miles an hour, really creates no damage to the car, but the linear acceleration of impact to the upper neck at that point is something in the neighborhood of about 5 Gs of force. And the reason, and this is the thing that I was trying to talk about, it's far worse sometimes than when you watch these guys on a racetrack going around at 200 miles an hour. The car looks like it's going to explode, and the guy walks away from the injury. But here, they're doing 200 miles an hour. That car was designed to do that. Here, these Joe Public that's out there, and he gets hit, she gets hit 15 miles an hour from the rear end, or from the front end, or from the side. There's no protection, so that energy goes to them.
Yeah, and you brought up an interesting point about the race car drivers. Their seatbelts cross over their chest in an X. So when we wear a belt, it crosses over from the left to the right. So inherently, that design is going to build more tension into the system, so to speak, as far as when we get into an accident, our body's going to be thrown in specific directions. So you don't have to be going fast to get hurt anymore.
No, you don't at all. It's and people don't understand that. The unprepared person is the one that gets hurt the most. If you're locked in, if you're braced properly, if you have things that, because cars today are designed to absorb the impact before it goes into the occupant. That's part of the national safety intent. So here you've got a 15 mile an hour impact where it doesn't really get absorbed by anything except for you. And I often tell patients, take 2 bottles of water, visualize 2 bottles of water, and 2 are in plastic, and then take another set that 2 are in glass. Smash the glass together with these full bottles of water. The water drops directly down. You take the 2 plastic ones, and you hit them, and they careen back and forth against the thing, causing more energy impact to the water and less to the substance. So the car doesn't get damaged sometimes at a low impact, but the occupant does.
Cars are designed to take a lot of abuse. Bodies are not, and that's the end product. Sometimes I think we're better off when we're not prepared for the accident because we're relaxed. So, when we anticipate something's going to happen, we tense up, and that tension in many cases can make the accident way worse. And certainly, I've been in motor vehicle accidents, and the head-on ones, when you see it coming, are not the pleasant one.
No, they're not, because then everything in your body tightens up. And actually, sometimes that's far worse because you're prepared. And we don't realize it sometimes that we're hit and we're looking down, and we're turning the radio on, we're looking to the left. There's very specific structural damage and neurological damage and impact that goes along with that as a result of your position in the car. God forbid you're texting, you have a cell phone, whatever you're doing, that even enhances the problem and makes it far worse than that. Let's talk about the neurology. We talked about all these symptoms that are going on. Our patients come in and they say, I don't know when this started. So they have stomach upset, they have back pain, they have numbness in their hands and so forth. Not only are the spinal nerves and muscles involved, but as you said initially, that the cranial nerves and the neurological system and the automatic system is involved. How does that happen sometimes from just a simple impact and then carrying over for years to come without healing and resolution?
Well, when we sensitize a fiber, a nerve fiber, that means that we activate it. And the most common way that we typically activate a nerve fiber is through some sort of trauma or injury. And like I said before, because those pain fibers talk, and literally they do that they communicate with the autonomic nervous system. Once it's turned on, if the system doesn't turn off, then it develops what we call wind up, which means that the autonomic nervous system or the sympathetic nervous system will start to just spin out of control and will physically take the rest of the body out of the picture. You can see that in extreme cases as phantom limb. We've all heard about people who've lost an arm or a leg, and they tell the doctor that they still feel it. Well, that's the autonomic nervous system being wound up. And in many cases, when people have injury, head trauma or motor vehicle accident, this is what happens in the end product.
My guest in studio, Dr. Harlan Browning, who'll be your host, your presenter this Wednesday evening, the 1st of October at the Roselle Center for Healing. We're going to be talking about whiplash injury or traumas to the head, neck, and spine that you're not even aware that took place. Join us. All you got to do is call 703-698-7117 and find out why you're still hurting and why you still have the numbness and why you still have the nausea, blurred vision. We'll be right back. Don't go away.
105.9 FM and AM 630, Washington's Mall, WMAL, where Washington comes to talk.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. Dr. Harlan Browning. We're talking about impact injuries, whiplashes, and all the different symptoms that can come about and not even start till many years later, and you wonder where it all came from. Well, this is going to be an eye-opener for you. Matter of fact, this presentation this Wednesday evening, October the 1st, at the Roselle Center for Healing, 7:30 p.m. You're all invited. Please attend. If you have any questions whatsoever, I promise you, those of you who heard Dr. Browning before know that he's a treasure chest of information. It can really pinpoint things. Call 703-698-7117. That's 703-698-7117. Remember that absolutely no charges for these in-house continuing education programs. Love to have you as our guest. Let's go to the phones. Joan, thank you for being so very patient. How can we help you?
Yeah, I've been hearing about the flu shots, and I'm wondering what do you think about the ones that they're offering for people over 65? I understand there's a difference.
Well, yes, there is, but let me give you across the board my opinion type of comment, okay? Don't do it. Right. The effectiveness of the flu shot across the board for all ages, according to the CDC information that was just released, is 56% effective. You have a better chance of flipping the coin and taking your chances. Now, that's not setting aside the side effects that go along with this thing. And at that 56%, I think it's highly exaggerated. Cochrane Database Review is the gold standard in reviewing any of the questions that relate to flu shots and the side effects and so forth, and it's out there. All you have to do is look up Cochrane Database Review, and you'll find this. But let me just give you a kind of a side effect of the flu shots. There's something called low platelet count, where you can't clot. Thrombocytopenia is what it's called. Guillain-Barré syndrome, spinal cord inflammation, optic problems where you have inflammation of the nerves of the eyes, enlargement of the lymph nodes, paralysis, facial Bell's palsy, numbness, tingling, itching, anaphylaxis. There's a vascular inflammatory problem that destroys blood vessels called vasculitis, shortness of breath, chest pain, brachial neuritis, that's numbness and so forth in the arms, the hands, and the shoulders, convulsions, fainting, dizziness. I can go on. I mean, these are things that they admit to, and if you go into the Cochrane database, I don't know about you, but it's not going into my body. There are many different ways of protecting yourself from the flu, and it's called eating the way you're supposed to, get a good amount of rest, make sure your vitamin D levels are quite high, take vitamin C, zinc, echinacea throughout the wintertime, and wash your hands. You don't have to use an antibacterial because the flu's not a bacteria, it's a virus. So it's not going to work anyway. But keep yourself rested, healthy, well, and get a little exercise, and you'll find that you do far, far better than anybody else that's out there. Our health index is horrible. So be proactive, and you don't have to worry about this. And as it gets into the older generation, and I'm going to use that because I'm part of that, anybody above 50, the effectiveness is even worse. And if you don't have an immune system to begin with, and they give you the flu vaccine, guess what you're going to get? It's called the flu.
Right.
So I would encourage you not to, okay?
Okay, well, thank you.
Joan, thank you very much. Dr. Browning, do you have any addition to that?
You know, the vitamin D thing is really, I think it's underplayed and extremely important. Specifically when you look at the blood values, typically the normal blood value of a vitamin D is going to be between 32 and 100, which means that if a person has a 33 or 34 or a 40, they're going to be looked at as normal. I particularly like healthy folks, and that's people who don't have any diseases or there's not a strong family history, to be at least at 50. For those folks that have problems or there's a family history of it, I like them to be at about 70. We can't underestimate the power of vitamin D, and it also carries over to pain, the things that we're talking about this Wednesday. If we have low vitamin D, we're much more susceptible to pain, which is a very fascinating aspect.
Yeah, the information's out there. Vitamin D levels should be high, and there's a lot of authors and there's a lot of opinion, including my own, that is a little more aggressive, I like to see the vitamin D levels from 70 to 80 because that's when good immune function kicks in. Immune system starts being protective at 50, absolutely. Anything under that is considered insufficient. But you've got to get the vitamin D levels. You have to know what your vitamin D score is. And the only thing that you have to remember is keep it under 100 units on a blood test, and then you're pretty good shape.
And we want the vitamin D, the D3.
That's right.
The number 3. And if you think you're going to get enough vitamin D from the sun, you're probably mistaken. And if you think that you have enough vitamin D in your multivitamin because it says 400 units and that tells you it's 100% of the daily requirement, you're very wrong there.
Yeah, you're not an automatron sitting on the couch getting nothing. We're coming up to a break, and we're talking about whiplash injury. We're going to get into the why, what happens, and so forth, and what you can do about it. After the break, don't go away. Dr. Browning is an amazing intellect, those of you who know and have heard him, and trust me, you don't want to miss his presentation this Wednesday evening. You're listening to Dr. Tom Roselle Live. We'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. Love to take your phone calls, 888-630-9625. That's how you find us here. How you find us when we're not here is you go to rosellecare.com. That's ROSELLECARE.com. My guest in studio, Dr. Harlan Browning. We're talking about whiplash injury and what happens with minor traumas and blows and significant traumas and blows. Dr. Browning, this Wednesday evening, the 1st of October, you're going to be presenting on this topic, and I know you're going to get into the intricacies of it. Whiplash is serious. It can be very, very far-reaching in its ramifications, and it can show up later on. So here's a question. Patient has a car accident, and they don't think too much about it. They got hit. They got spun around 15, 20 miles, maybe even 30-mile-an-hour impact. And, they're told, like so many others, it'll go away. Don't worry about it. Take this aspirin. Call me in the morning. But a year from then, 2 years from then, all of a sudden they have this pain that starts, or head pain, or headaches, or dizziness, or tinnitus, numbness someplace in their body that there's no explanation for. How does something in the initial stages where they were told, don't worry about it, now a year or two or even 3 or so later, now they're starting to have problems?
Well, you can look at it in a couple ways, and one thing we haven't touched on, I think it's very important. When people get into a motor vehicle accident or any accident for that matter, we traumatize the brain as well, and that's typically called a concussion. And in very many cases, a concussion doesn't involve blacking out. It just involves traumatizing the brain, which might not show up initially as anything. The person might feel perfectly fine, but if we damage the brain, we might start to see 2 or 3, 4 years later that the person's complaint might be, my memory's just not as good as it was. So certainly, if we injure our brain, we're going to have issues down the road, and we need to be assessed. We need ways to look at this. On the outside, if we start to traumatize the spinal cord and the nerve roots themselves, the body's going to adapt to that. We're going to get muscular splinting. The muscles are just going to get tighter to protect us. Sometimes those muscles don't relax. Even though we don't perceive there to be any pain, over time, as these muscles contract, it physically straightens the spine out. So one of the things that I see all the time with chronic injuries or chronic pain patterns is the person starts to lose their curve, or the lower dosis of the cervical spine, which can be very detrimental to the health of the spine itself and the discs in between it.
Unfortunately, when you go get an X-ray, most medical physicians, there are some that do report it accurately, but they'll take an X-ray of your neck and they'll say normal presentation. And unless they see significant degenerative disease within the spinal system, they call it normal. And the truth of it is, it's not normal. As you know, my wife, Sue, had a very straight reverse neck when she was a young girl that was contributing to her migraine headaches that she had from the time she was 6 years old. And there was no degeneration, but they wanted to go in and they wanted to fuse every segment in her spine to stop the neurological irritation, to her neck. But she went under very specific manual manipulation, and this is when she was, this is 40 years ago, and to this day she hasn't had a problem. But the look at these things are significant. Let's hold that thought because I've got a couple questions, but we have several people that are waiting patiently. I want to get to them. Ferdinand, how can we help you? Thank you for being patient. I appreciate it.
Yes, thank you. I'm sorry, this is off topic, but I was wondering, how would you treat de Quervain's syndrome, kind of related to carpal tunnel syndrome? I've got this pain in my wrist, and it's been there for like 9 months, and I can't get it to go away.
Ferdinand, it's Dr. Browning. So you're getting the pain by your thumb?
Yes, yeah.
So
under my thumb.
Okay, so de Quervain is what's called tenosynovitis, which is inflammation of the tendon, and tendons are what connect muscles to bones. Typically, that happens when people do something repetitively over and over again. The reason that it typically flares up is because the tendon will be rubbing on the bone that's underneath of it. So one of the things that I look at when I see somebody with de Quervain's is how mobile is the wrist. There's 8 bones in the wrist, and they need to be specifically mobile to allow us to grasp and do things with our hands. But more importantly, they need to be mobile because there's a lot of tendons and there's certainly a lot of nerves that pass through there. And when they are stuck in position, then they will often rub on it. So the one thing I would look at again is the mobility of the wrist. And has there been an injury to it?
No. I think I do a lot of repetitive motion. I work in the fast food industry and I wash dishes a lot. So I think that's the problem. But my wrist is still mobile.
Well, the mobility may be you looking at it as it flexes and extends. What I'm specifically talking about is the little tiny bones in there. They might not be aligned properly, which will rub on that tendon of the thumb and inflame it. So easy to fix, so you can certainly give us a call and we can give you some more information on what we do for it.
It's far more common than what you might think, and it can start anywhere from the wrist itself, and as Dr. Browning was talking about, the 8 little bones in the wrist that allow you to turn and twist your wrist, and you've got 2 long bones behind that, and then you have this huge sheath of fascia. It's like plastic wrap that holds those bones in the distal portion of the arm in position. And if any of that's strained, even going as far as the elbow and the shoulder, causing a cascade of muscle imbalance all the way through, then the hand's not going to work the way it's supposed to. And the kind of work that you do is very, very much susceptible to that type of presentation. But as Dr. Browning said, this is something that can be resolved very nicely. If we can help you, please give us a call. Susan, thank you for holding, and how can we help you?
Yes, hello. I have had an ablation years ago for atrial fibrillation. I have edema in my legs, and I'm always fatigued. Now, I'm on furosemide, and my doctor has just given me, I just picked up the prescription, a Pixaban, 2.5 milligrams, and I got on my computer, and I'm afraid to take it. He tells me it'll prevent me from getting a stroke.
Yeah, it also could cause you a stroke if you read through the side effects of it. I mean, with all these things, you can have bleeding that can take place. So you're trying to prevent a stroke. They're trying to prevent a clot stroke. But what can happen is that you can end up with a rupture stroke. It's the same type of thing that we talked about a few weeks ago when I said that I had been vindicated that the FDA had to reverse its position on aspirin. Aspirin actually will cause the problems it's trying to prevent because it increases the bleeding. It actually will increase stroke risk. It increases clotting risk and heart attack. It'll cause different types of cancers and so forth. And the list goes on. I spent a few minutes on that day. These are no different. I mean, they can cause all kinds of problems from your kidneys to numbness and things that we're talking about. It can predispose to different types of stroke, increasing that risk level. I mean, if you go in, you read the side effects. In my opinion, there are other things that you can do to allow your body to reach a harmony, a balance that you're not going to clot. When you look at from our point of view, you're going to look at diet, you're going to look at neurological influence to the heart. Heart has 3 neurological input. It has the nerves that come from the spine and come from the brain that go to the heart. That's 2, I'm sorry. And then the next is the pacemaker within the heart. Then you look at the mineralization, the things that the heart needs to work. You look at the fibers themselves. You start talking about things like coenzyme Q10 and things that allow it to work effectively. Essential fatty acids, your omega fatty acids, work far better in keeping the blood from clotting without the potential side effects of all this other nonsense that they're producing. You know, sometimes immediately after surgery you need something for a short period of time, but long term there are nutritional things that you can do that you should know about. Susan, if we can help you, I mean, we're more than happy. Dr. Browning is, not only a specialist in chiropractic neurology, but he's also a nutritionist. He also has tremendous credentials, as I do. Sue, who's head of our nutrition department, does functional medicine protocols. You at least owe it to yourself to get the data, the information, and help get somebody who really will give you the information so you can make the proper decision in your health and your life.
Yeah.
Okay?
I'm taking a lot of vitamins.
Like what? Give me a couple quick ones.
D,
okay, good.
B vitamins.
Good.
Vitamin C.
Okay.
Selenium, I think it's called.
All of those are great. Several of them are antioxidants, but you still need omega fatty acids. You need an exchange. Give Sue
acid?
I'm sorry?
What did you say about the acid?
No, what I said is that you're taking some good things, but you need some other protocols. Give Sue a call in our nutrition department and talk to her. Set up an appointment to talk to her, because I think there's far more that you should be doing and could be doing that's not even touched upon at this point. Give us a call at 888-630-9625. That's 888-630-9625. Dr. Browning, let's get back to whiplash and trauma and injury and, things that go bump in the night, so to speak. Patients come in, and obviously, anytime you have a head or neck trauma, you can affect all the sensory elements. Hearing can be affected. That's where the tinnitus and so forth comes in. You could do damage to the cochlea and destroy some of the hair cells that that not only give you the ability to hear, but space balance, and that's why patients get vertiginous. When those things in the vestibulary, the brain, the same type of thing. How about the long downstream visceral signs and symptoms that are associated with post-trauma, post-traumatic situations like whiplash? How does that come about?
Well, it can come about from several reasons, but I think that the most common reason is the body is good at adapting, and sometimes the way that we go through adaptation might not be the best way to preserve our health. So when we sustain an injury, our nervous system tries to stabilize it, and it'll make muscles get tighter, and certainly we will start to hold our body differently. Our posture will become different. In extreme cases, we call it antalgia, where we'll when we limp or when we have a sore foot, we'll move our pelvis in a different way. But in many cases, we will develop this antalgia and not even know that we're doing it, because the body is very good at masking things and trying to preserve our health as we move forward.
The longest nerve in the body is one called the vagus nerve. It's a cranial nerve, and it comes down and it touches multiple organ systems, from the heart to the lungs, the stomach, the large intestine, intestinal system. Even some authors say that it touches the fundus, the upper portion of the bladder. That nerve is often a culprit in so many different presentations and symptoms. How does this nerve get tweaked, if you will, in a trauma or a traumatic situation such as a whiplash?
Well, it can be literally stretched or compressed as it passes out through the skull itself. It runs a fairly tortuous course through the upper cervical spine, so it can get pushed or compressed against the bony structure, because as it pierces through muscles in the neck, and as it passes through the chest cavity, it can get compressed there as well. So in many cases, people will will traction this nerve or stretch it, and that's why they'll develop the nausea or the unsettled stomach or difficulty breathing or all those type of things that we call autonomic concomitants.
That's a big word.
That is a big word.
That's a huge word. So that means things that are associated with and can be caused by.
Yeah, the autonomic nervous system, which is the automatic portion of it. That there's the rest and digest, and then there's the sympathetic. So the vagus nerve is the rest and digest. So if we irritate that nerve, then the resting part and the digesting part won't be great. So the person might have digestive problems or just not be sleeping well or wake up in the middle of the night and not have any reason for it.
Dr. Harlan Browning, your presenter, your host, this Wednesday evening, October the 1st, 7:30 p.m. at the Roselle Center for Healing. He's going to be talking about trauma due to car accidents, falls, falling asleep and your head rocking forward, things that you wouldn't even think about seriously that cause irritation to the neurological network that comes from the brain, the spinal cord, and the nerves that come off of that. If you ever wondered how in God's name did this happen to begin with, this is an opportunity to find out about that. And those of, again, that have heard Dr. Browning present, this is a home run. So please join us. All you have to do is call 703-698-7117, 703-698-7117. Tell my staff you'd like to be there. Again, our gift to you, all of our in-house continuing education programs, is a way of contributing back to the community so you learn what's going on. And we're always there for you. We're always here to help you. This is a situation that, and particularly in my own life, having suffered a lot of different traumas and blows and things to my body from playing ball and martial arts and multiple car accidents and things that have happened, smashing my head every time I turn around. God knows why, but I do it. And so you end up with symptom processes that sometimes, I know where they're coming from, and I've got guys like Dr. Browning to take care of me, thank God, because otherwise I'd be in a really bad place, but they keep me functioning mobile. We want to keep you functioning mobile. We want to be able to at least give you the data, the information, so you know how to help yourself, and we're talking about this long nerve, how it gets tweaked. When the structural system is not balanced, the body is not balanced, and things don't work the way they're meant to be. Dr. Browning, why is it so important, and we got about a minute before we go to a break, that these problems, even though that you're not fully aware that you're going to have a huge cascade, why is it important to look at this now and not put it off for, well, I'll wait till it gets worse, take these 2 aspirin, and, let's see what happens?
Well, I think the most important part is to prevent any type of what I call permanency or impairment. If we sustain trauma to the spine or any joint in the body, there's a much greater likelihood that joint's going to degenerate over time, and we call that arthritis. So once that arthritis is put in place, you can't make it go away. You can certainly make it better. So I think the real reason that people need to assess themselves after an injury is to prevent any type of degenerative situation that might occur down the road.
One of the things I can say is that think about a house. When the base, the foundation, or anything in the house is not constant, it's not solid, pretty soon everything above it is going to begin to break down. If you have a crack in your window or your ceiling, check the foundation. Same thing with your body. Have to check what's going on and don't just put up with it. We're coming up for a break. Don't go away. We'll be right back.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. We've been here at 888-630-9625 as we are every Sunday, 12 o'clock, bringing you the most intimate and updated information on integrative care, but for your education. That's why we do the program that we do. That's why we're here, and that you can get a hold of us. You can ask us questions. You can go to rosellecare.com, ROSELLECARE.com. Send us a note. We'll get back to you. We'll talk to you about, what we can do to help you or what you can do to help yourself, which is more important. Remember, as my book says, Ageless Health, health is a do-it-yourself program. You're the ones that are in control. Speaking of Ageless Health, 2014 is coming up. Ageless Health 2014, Saturday, October the 18th. It is a day that will impact your life forever. I promise you that you will have never experienced anything like this. And those of you who've been there before, you also know that we change the data every year because we want to give you as much as we possibly can. This is an over-the-top program. It starts in the morning, ends about 5 o'clock in the afternoon. It gives you the ability to take control of your health, create a greater wellness for you and your family, and, just really know how to do it. We'll give you the steps that you need to take to put into place. It's a day, one day. Are you willing to take that step? Are you willing to, to really commit to it? And it's inexpensive. Go to the website, agelesshealth2014.com, or just go to rosellecare.com. Register today. Get it done. It's only 2 weeks left. We want you there with us. We want to be able to educate you. We want to be able to give you the capacity to help yourself. $99 for the entire day. Register online. Save $5. Register for 2. Save a little bit more. Be there. I can't insist and recommend and encourage you any more than I am that this is something that will blow your socks off. It's an amazing day. Please, please, please be with us. Dr. Browning, one more quick piece on whiplash injuries. This Wednesday night, 7:30 p.m., Dr. Browning will be your host, your presenter at the Roselle Center for Healing. Be there, 703-698-7117. Tell us about, very quickly, within a minute, how the phrenic nerve is damaged in a whiplash injury and why it causes the problems it does.
Well, what you're talking about, Tom, is one of the major nerves that goes to our diaphragm, and our diaphragm is the major muscle of respiration. So if we irritate this nerve, and it's very similar to that vagus nerve that we spoke about as well, it weaves its way down into the chest wall, then we're going to see the diaphragm become spastic or not work properly. And if that happens, then we're certainly going to have problems breathing. But in many cases, it might not be a respiratory problem. The person's major complaint might be digestive. And if it starts to compress or irritate the esophagus, that's the tube that goes down to our stomach, then reflux might be the major issue after a motor vehicle accident, and it's much more common than people would think, but they'll never make the connection.
That's what I wanted you to bring up. A lot of these reflux problems, these GERD problems, come as a result of injury to the spinal system, particularly the neck, after minor trauma. And again, it's not something that you're going to be aware of, and it's not something that traditional medicine is going to tell you about. We've got to take a break. Unfortunately, we'll be back. And unfortunately, you have to listen to me. And fortunately, I'm going to give you all the tools that you need to have to make your life better than it ever was before. Seriously, though, we're here anytime to help you. This is Dr. Tom Roselle. See you next week. Bye. Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117. This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.